I am Teonna Woolford, and I am 30 years old, living with sickle cell disease genotype SS. So just a little bit of background about my story. About 11 years ago, I actually had a bone marrow transplant, which is the most invasive thing you can do to try to cure yourself from sickle cell. And I have since then rejected the transplant and now have issues with my bone marrow. And I also still have sickle cell. So, like our most researched drug, hydroxyurea, I'm very sensitive to that because it has low dose chemotherapy in it. So, I am someone that would directly benefit from access and approval of new therapies. Next slide, please. So here I just have a picture, or that was a collage of individuals living with sickle cell disease and sickle cell trait, just to remind us of why these conversations are so important. Next slide, please. So this is a little bit, I think that we all probably understand that sickle cell is a genetic disease. So individuals are born with it. And basically, I think that sickle cell, there's a lot of misunderstandings and misconceptions. And a lot of times when people do think of sickle cell, they just associate it with the disease of pain. And while pain is one of the hallmarks of sickle cell, we have to be mindful that sickle cell affects anywhere there's blood flow. So any organ, all the vessels. So ultimately, sickle cell is a disease of shortened lifespan where the life expectancy is 40, which has come a long way because just 30 short years ago, individuals with sickle cell disease were not living into adulthood. Another huge burden of sickle cell is fatigue. Like a lot of us develop a high pain tolerance, but because of the severe anemia, because of how quickly our red blood cells die, fatigue is something that can really impact the quality of life, which leads into problems with mental health and isolation. And a lot of times we think about the isolation among adults with sickle cell, but because of a complication that causes delayed puberty in children with sickle cell disease, that the concept of isolation can start really early. And then our males with sickle cell, because this is not just a women's health issue, this affects everyone. They deal with something called priapism, which is long and painful erections lasting for hours, even days. And lately, there's been a lot more research. So we know that individuals with sickle cell disease, because of iron overload from transfusion therapy, from medications, and from just simple disease progression, infertility is at risk, organ damage, stroke, jaundice. These are just a few of the complications that individuals with sickle cell experience. Next slide, please. So I just kind of wanted to walk everybody through the journey so that they can understand what the sickle cell disease community has been going through since discovery in 1910. Our first approved drug was called hydroxyurea, and that was approved in 1997 for the treatment of individuals living with sickle cell disease. However, it had already been an approved drug to treat other disease communities. So then you see that it was almost 30 years before the sickle cell community had any type of disease modifying therapy. So in 2019, we were very grateful because we had Oxbryta and Adakveo both through accelerated approval. And then I have this blank because this just represents the future, because it's my understanding that there are over 40 disease modifying therapies coming down the pipeline for individuals with sickle cell disease. Next slide. So here I just have some quotes, and I have permission to share these with you from individuals in the sickle cell community, and they're speaking to how both Oxbryta and Adakveo have changed their lives. So one patient, Natasha, says, being on Adakveo has been life-changing. She has not had a crisis in almost a year and a half. Another adult patient, I started at Adakveo last year. And since being on Adakveo, I've had less hospitalizations. I have more energy and I'm starting to feel like myself again. And then we have Zara and Keisha Weeks, who Zara is actually 9 years old, which we know that Oxbryta just got approval for children under 9 years old. So Zara was fortunate enough to participate in the clinical trial. And it's so important that children with sickle cell have access to these disease modifying therapies early because it can really prevent them from dealing with a lot of the deterioration that would happen if left untreated. Next slide, please. Oh, I'm sorry. Can you go back 1 second? I also have a quote from Jennifer McNary because I wanted to show, obviously, that accelerated approval not only benefits individuals with sickle cell disease, but families with other rare diseases. So Jen is the mother of a son with Duchenne, and they have benefited, and accelerated approval has been incredibly important to them. So that just was another quote from somebody who is really dealing with these implications. Next slide, please. So this is just my final take-home message. Again, I want to thank the organizers for having me and thank you guys for taking time to listen to my story. So just the take-home messages are that patients cannot afford to wait. Like any time, any day, any month, any year that a drug is going unapproved is a potential day that somebody is suffering unnecessarily. But I also want us to be mindful that approval does not mean access. And so we have to continue the conversation and continue the work because there's a lot of work that has to be done on the state level to make sure that when we do get these drugs approved, hopefully through accelerated approval, we have to do everything we can to make sure they actually end up in the patient's hands. So thank you everyone for listening.